Friends, greetings from the Department of Urology at the Kokilavin Dhirubhai Ambani Hospital in Andheri West in Mumbai. It is important for us to address sunshine and pink of health for everybody in sometimes difficult diseases which are refractory to known treatments. The standard of care in some treatments offered by urologists, offered by various specialties, may not conform to the therapy and to a cure or a treatment that you aim for. Let's look into these diseases and look at one therapy which actually has made a difference. So, friends, refractory overactive bladder. An overactive bladder which contracts erratically and for which we have got lifestyle changes and medications do help majority of patients. So majority of these patients are getting medicines called antimuscarinics or a combination which is antimuscarinics and beta 3 agonists that your doctors would give you to bring about an escalation of the requirement in the aspect where your urinary frequency is high, you've got urgency and you can't control urine. But there's a small subset of individuals, which is quite significant in the world, where patients can't control urine despite all the medical treatments, all the kind of lifestyle treatments which have been given to them. Their urodynamics, their botulinum toxin therapies don't give them the result where they can be out of diapers. When they feel like passing urine, they have to rush, they have to go and pass urine. They can't control urine, they leak incessantly. And this kind of a refractory overactive bladder which cannot be managed with known medications and known combination therapies and escalates up the ladder, requires a specific kind of a treatment, which is called as sacral neuromodulation. The other set of patients who are refractory non-obstructive retention, NOUR, non-obstructive urinary retention, are those individuals who could either have a hypocontractile bladder and the bladder doesn't contract to push the urine out and the urine stays back in the bladder, significant to large enough. Many of them have to live on a catheter or a clean intermittent self-catheterization. Individuals of this kind are labeled as refractory hypocontractile or a hypotonic bladder, as proven by the urodynamic studies. The third group of patients are those who actually have got refractory fecal incontinence or refractory obstipation. Individuals who have got nerve sensations such that it does not conform to the normal kind of an hybrid in the pelvis brings about changes which cannot be normally managed with the medications or escalated dose of medications. They would require sacral neuromodulation. And finally, the fourth patients could be those who actually could have chronic refractory pelvic pain, quite neurological and not organic, where doctors have attempted their medical therapies escalated up the ladder with various neurological medications, and we haven't got results yet. At the Kokilam Dhirubhai Ambani Hospital's Department of Urology, over the last few years, we have rejuvenated this therapy, which was being done in the past, back to the niche area therapy of sacral neuromodulation. And what do we do in such? We bring about improvement in the sensory and the motor responses to the pelvic zone, which could include the urinary passage, the entire pelvic floor, which could include the fecal passage, and bring about changes in the entire nerve activity, which probably has gone somewhere haywire. In doing so, we are able to stimulate the right nerve by a needle prick, which goes and touches the nerve, and thereafter a lead actually stimulates the nerve to bring about a modulation as required, which means the sensory and the motor inputs to the end organs of the bladder, to the intestines, to the pelvic floor is improved dramatically. Friends, sacral neuromodulation is a therapy for these refractory states of refractory overactive bladder, where the medicines are not controlled. You're living in diapers, can't control, medications have failed, escalated therapies have gone up the ladder, but still no results. Refractory non-obstructive urinary retention, which in common parlance and medical science would be called as refractory hypotonic bladders or refractory hypocontractile bladders, where the bladder doesn't contract to empty your bladder. They're not atonic bladders completely, but these are those individuals who could be diabetic of long standing. There could be some neurological changes happening. And it's somebody like us who have to diagnose this on the basis of evaluation, examination, and finally a urodynamic studies, which is a multi-channel flow studies to give us an idea. We look at individuals who have got fecal incontinence, where the feces actually leak out before they can control. There's no injury, there's no trauma, there's no organic cause, but the feces leak out functionally. And finally, chronic pelvic pain of the refractory kind, which is not healing. On all these four indications at the Kokilaben Hospital, I continue to take the indication to the highest level by attempting at a test lead called the Tyne lead, which is implanted by under a local anesthesia sedation when you are lying on a prone position. We place that needle directly on the S3 foramina and actually stimulate the nerve to bring about a modulation of the nerve activity in the pelvis. It actually works wonders. So patients have different responses, and the responses are measured on the operating table while the patient is cooperating and is aware of the changes happening in terms of vibration, in terms of movement in the region of the rectum, in the region of the perineum, in the region of the motor responses in the legs. And these are all closely monitored on one side on the motor and the sensory responses. On the other side, as we continue to place the lead and look at creating pockets for the tunnels to be created, we look at the C-arm helping us to monitor the whole thing. The entire procedure lasting between 15 to 45 minutes or even beyond is to be tested on which side we are better off, and that is what is connected to a external neurosensitive device which actually is modulated by a handheld device, and you study the effect and bring about an optimization of the effect over the next 7 to 15 to 21 days in the maximum. So time lead is a test phase which allows us to move forward to give you a modulation on your urinary, on your bowel, on your pelvic floor sensitivity control levels, and helps us to finally implant the InterStim, which is the new era device of the sacral neuromodulation, whose battery could last anything between 12 to 15 years. Patients over the last 2 years have got implanted as young patients, as middle aged, as patients who had congenital issues, as patients who had got acquired neurological issues, as patients who turned hypercontractile bladders, and individuals go through the journey of improving. Majority of them have done very well. Some of them had got moderate results, and few of them would not be able to succeed the time lead, depending on how much of the nerve can be stimulated. But there is no other choice. In other words, sacral neuromodulation works by modulating the motor and the sensory responses in the pelvis, and therefore the end organs which actually are sleepy, not capable enough, hyperactive or underactive kind of a picture can be stimulated to the best possible levels, provided we choose the right patients around. The patient understanding is a lot of understanding between the evaluations. Patient understand that they need to get it sorted out. I always look at say yes to S&M when required, because in this refractory overactive bladder, refractory hypocontractile bladder or the non-obstructive urinary retention, refractory fecal incontinence, which happens to individuals sadly for multiple reasons in the pelvis, neurological and non-neurological, and finally refractory chronic pelvic pain not responding to medical management or escalated doses of therapy can actually manage by sacral neuromodulation. So sacral neuromodulation has come to stay. It is something which probably will be required for niche areas therapy in the right individuals that we continue to do at the Department of Urology at the Kokilaben Dhirubhai Ambani Hospital. Having worked on this subject, having trained on this subject in the past, and the new era devices having been available in India, I think it's a kind of a promise of ushering new therapy which we can take to the highest possible level. So if you're aware of this, take it forward to the next possible level and get yourself treated, evaluated, and taken forward to the next possible level where you lead a life which is again a lot of sunshine and a lot of pink of health compared to the refractory states which have actually held you back. Wishing you good luck. Let's take a neuromodulation be a yes to the right individuals by a two-step approach, which we do in the gap of anything between 1 to 3 weeks, where the escalated dose of time lead placement gives us an idea about the success rate of these individuals. Thank you so much.